A 45-year-old lady walked into my clinic recently with a complaint. Doctor, my vision is dipping. Then she casually said something that immediately caught my attention. She said, 7 years ago, they told me I had BP in the eye. And I immediately knew what she meant. She was talking about glaucoma. I asked her, did you take the drops regularly? She smiled and said, Doctor, I took it for 1 month, but it didn't feel any change. So I stopped it. That's when I had to tell her something very, very serious. Ma'am, if this BP of the eye is not treated, you can permanently lose vision. But first, I corrected one thing. It's not BP. BP happens in the blood vessel. What she had was glaucoma. And glaucoma has a scary nickname. Wait for it. It's called the silent thief of vision. Vanakamunga. My name is Dr. Muruganand. I am an Indian board certified senior ophthalmologist practicing here in Chennai. And welcome to the medical podcast. We are observing World Glaucoma Week. So let's talk about something extremely important, and that is glaucoma. So what exactly is glaucoma? Inside your eye, there is a fluid constantly being produced. Normally, it drains out through a tiny drainage channel. Now, think of it like a wash basin drain. If the drain is open, water flows smoothly outside. But when the drain gets blocked, pressure starts building up. And when pressure builds inside the eye, it slowly damages the optic nerve. The optic nerve is basically the cable connecting your eye to the brain. And once the cable gets damaged, the vision loss cannot be reversed. Now, why is it called silent thief? Because most patients feel nothing. No pain, no redness, no warning. Vision slowly disappears from the side. You lose your side vision first. And how many times in a day do you check your side vision? Unless you're Bruce Lee. If you have seen some of Bruce Lee's older visuals, he would use his silent vision to attack villains, right? But how many times in a day do you check your side vision? Never. You're always looking ahead. But since our brain compensates for this loss, we will not realize it. People don't realize it until it is too late. It's like a thief entering your house. Not through the front door, but slowly stealing things from the back room. By the time you notice, half the house is empty. So who's at risk? Now let's see who glaucoma likes the most. If glaucoma had a favorite customer list, it would include people above 40, people with family history, diabetic patients, high myopia, people with that soda booty thick glasses, and long-term steroid users. Basically, once you cross 40 years, glaucoma starts watching you like a Tamil cinema villain watching the hero, quietly waiting. Kanna. So what are the symptoms that people with glaucoma usually come with? Most glaucoma patients say the same thing. Doctor, didn't paro poiche. Doctor, suddenly my vision dropped. But the damage actually started years ago. Sometimes patients notice difficulty seeing in dim light, missing objects from the side vision. இந்த பக்கம் ஒரு தனிப்பான இருக்கும், தெரியாம அதுல போயிடுச்சிருவாங்க. Frequent change of glasses, and in advanced cases, tunnel vision. So how do we diagnose it? Now here's the good news. Glaucoma can be detected very early using an eye checkup. At my clinic, I do a few things. As a patient walks in, I check their vision, and mandatorily, if they're over 40 years, I check their eye pressures and I dilate them. And when the patient comes into my chamber, the first thing I would do is to check the optic nerve, which is the nerve in the back of the eye inside the retina. In glaucoma, the nerve develops a characteristic cupping. And once I know that, I will ask for a OCT RNFL. Now, this tells me the health of the optic nerve. And if all of this are pointing towards glaucoma, I start thinking of them as a glaucoma suspect, and I ask them to do what is known as a visual field test. And this tells us if there are blind spots in the peripheral vision. Now, these tests allow us to catch glaucoma very, very early. So when your ophthalmologist is asking you for these tests, just don't go and question him. Sir, in the test you need it. Your ophthalmologist knows it best. When it comes to treatment, if detected early, glaucoma can be controlled very effectively. Your treatment options include eye drops, laser treatment, surgery in advanced cases. But here is the most important thing. Vision loss from glaucoma cannot be recovered. But if caught early, we can protect the remaining vision for life. So if you're above 40 and if you had someone in your family who had glaucoma, please get your eyes checked. In fact, for World Glaucoma Awareness Month, I'm offering a free consultation for glaucoma in my clinic. Just ping me on the phone number beneath, or you can drop a comment in the comment section. I will check your eye pressure, examine your optic nerve, and make sure this silent thief never touches your vision. Before I end, let me tell you a small story, something that's actually very personal. My grandmother slowly lost her vision because of late-stage glaucoma. I remember watching her struggle. She couldn't recognize faces. She couldn't walk confidently. And the worst part, it could have been prevented if it was diagnosed earlier. She was diagnosed much earlier, but it was too late. Now, this experience stayed with me for a long time. And it is one of the reasons why I chose ophthalmology as my career. Because sometimes saving eyesight is not just medicine. It's giving someone back their independence, their dignity, and their world. So please remember this one line. Glaucoma steals vision silently, but an eye checkup can stop the thief. Thanks for watching. Stay healthy, protect your vision, and I will see you in the next podcast. This is Dr. M. Vanakkam.